Sometimes people worry that they have uncontrollable mood swings and they think that might be bipolar disorder, but that's not necessarily enough to make a diagnosis. You can't diagnose yourself just by reading symptom lists online. Often when we're worried that something is going on, we turn online and we try and find out the answer for ourselves. We look at symptom lists and we think, gee, a lot of those things sound like what I'm experiencing. But it can be really tricky to figure out whether or not those symptoms that you're reading about accurately match the ones that you've been experiencing. I'm Benjamin Veness. I'm a child and adolescent psychiatrist and a GED consulting expert. I'm here today to talk about bipolar disorder. It's great that you're thinking about what might be going on for you and that you're looking for help. That's the role of the professional, to help figure it out and to put those symptoms into context and to think also about other possibilities, because it's quite possible that symptoms of different disorders or even problems in life might overlap. Bipolar disorder is a condition that's most commonly characterized by mania, and a manic episode is one that typically lasts for about 7 days, and you have a lot of changes during that time which people around you are very likely to notice. Things like talking really fast, maybe to the point that other people are having a lot of trouble interrupting you. Having ideas that switch perhaps from one topic to another and then back to another really fast, and other people might have trouble keeping up. People might spend a lot of money during a manic episode or do other risky things that are out of character for them. Sometimes with bipolar disorder, you can also have periods of depression. That's periods when your mood is really low for a persistently long time, not just a couple of hours and then it changes again. Because it can be really tricky to figure out, it's important for you to go and seek professional help. Start with your primary care provider or seek a referral to a psychiatrist. If you're a teenager, then a child and adolescent psychiatrist. If you're a young adult, then someone who has experience also seeing young adults. They'll ask you a lot of questions. It'll probably take quite a long time. You might even have to come back a few times. And they're likely to want to talk to your family or other loved ones as well to understand what they've noticed. And putting all of that information together, they'll then help you to figure out what's going on and whether bipolar disorder is the correct diagnosis, or quite possibly something else explains what you've been experiencing. In any case, help is available, and so it's really important that if you're worried, that you go and seek out that help so that you can get the right diagnosis and then get the right treatment to continue living a happy life. There is really good treatment available for bipolar disorder, and it's a mixture of medications, psychological therapy, and changes to lifestyle. Medications are typically things called mood stabilizers or antipsychotic medications. The types of psychological therapy might involve cognitive behavioral therapy, or something called interpersonal and social rhythms therapy. And the types of lifestyle changes that are important are getting really good and consistent sleep, being careful about alcohol and other drugs, and generally living as healthy a lifestyle as possible, getting good exercise and eating a healthy diet. Bipolar disorder is absolutely not a character flaw. It's a mental illness, but it's treatable. And if you're worried that you might have it, I'd really encourage you to seek out a proper diagnosis from your primary care provider or a psychiatrist so that you can find out what exactly is going on and so that you can get help.